We are live, so we can begin.
Hi, this is Santosh Ravindran speaking to you from Mumbai. I am a practicing dental surgeon from Mumbai and I have been practicing here for the last 28 years, graduate of GDC Mumbai. And today I have come to you thanks to Dr. Reddy's laboratory and thanks to the technical support of DocMode that I can come and interact with all you dentists regarding dentistry post COVID-19. Now, COVID-19 as a disease has crippled the entire mankind globally. We have seen how COVID-19 has actually attacked and brought us to our knees. In spite of all the technology that we have, in spite of all the healthcare facilities that we have, half the world is under a lockdown. And this has created such a sort of emergency situation that we do not know how to respond. But we are hopeful that we follow the instructions of the health authorities, instructions of our respective governments, and we should be back on our feet sometime or the other. So many professions have been affected, but here we are today here to talk about how it has affected dentistry and how we are going to get back onto our feet. Has it affected dentistry? Yes, definitely. In fact, the dental profession is probably the worst affected profession among all the medical faculties that we know. And we as dentists know that yes, we are the worst affected. And when we come back to dentistry, when we reopen our clinics, how do we do that? Now, there are some smart Alex who have never closed their clinics. Is it that they are not afraid of the virus, or is it that they are not aware of the consequences of getting infected? The second option is what is true, is that they are not aware of the consequences and they think that they are bigger than the virus. They think that if I continue practicing when everyone is shut shop, I will end up making more money and I'll end up making money when all the others are sitting without an income. It's a completely wrong thought process. And I don't think this is how a dentist needs to think how this is going to work. We need to be in our homes right now, obeying the national lockdown orders given by our Prime Minister Narendra Modi ji, and observe all the protocol that are being given to us by the health authorities. What do we do when we come back, whenever we do that? Now, in WhatsApp University, we have got so much of information as to what has to be done. We see pictures of dentists treating patients post-COVID. Dentist is wearing their entire personal protective equipment, if you can call it in a layperson's language, the entire cap and the shield and the raincoat. And the patient is kept inside a plastic box with two little holes, and the hands have to go through that to treat the patient. Now, is this practically possible or feasible? If we try to think, I don't think it's practically possible. Do we need to buy all this protective equipment? How much do we need to buy? From what equipments do we need to buy? Are all dentists expected to buy all these things? That is dentists from Delhi, Mumbai, Calcutta, Chennai, Bangalore, Hyderabad, and also the dentists from say Jalandhar, Warangal, Nagpur, or Bellary, or smaller towns. No, there is a completely different perspective to this. What a dentist from a red zone needs to buy and use will be different from what a dentist from a amber zone will need to use and a dentist from a green zone will need to use. So let us not jump to conclusions and get influenced by what WhatsApp has to teach us. Let us try and understand what we actually need to do. What are the things that we need to buy? Now, during this presentation, I'll also be showing you a few images of certain products and certain equipment that may be useful to you. So I would suggest you can take screenshots of it because I'm not sure whether this presentation is going to be available to you as a recording after the webinar is over today. So COVID-19, expect the unexpected. What did we know in the first half of March when COVID had just come in? What did we know? Nothing. We never thought that something like this is going to happen. And we never imagined that in the second half of March, a national lockdown will be announced. Half the world will be locked down. We never even thought that this would have happened. So we can expect the unexpected when we are dealing with this particular virus. So what are we expecting? When do we go back to work? We really don't know. We really don't know. But as of today, if situation settles down, and we see that the national lockdown is lifted on the 3rd of May, then we have a fair idea as to when we can get back to work. When we can get back to the clinic will depend upon the zone that your clinic is in. If the national lockdown gets completely lifted on the 3rd of May, then 14 days from them is when the
Hello.
we are not sure.
Doctor, connect your PPT. I think the internet connection has gone down. Just share your PPT once again, sir.
Yeah, yeah. There, done.
Yeah, sir, we can begin
Yeah.
now.
So we really don't know what to expect because this virus has been creating havoc, and we have not seen something like this in the last more than 100 years. And hopefully, we will not see it in the near future anytime. What are the current?
Hello. Hello, Dr. Ravindran. Yeah, sir, connect again. I think the internet is crashing, sir.
Yeah. So what we need to understand is whenever this gap will close, we should be prepared to pick the money from that money plant. We should be prepared to treat the patient correctly. We should be prepared to treat the patient ethically and do the correct things. So when do we start preparing from that? For that, we need to start preparing from right now. What do we do? Preparations during the lockdown period. Number one, coordinate with your associates and assistants regarding their safety and well-being. They feel good if you're in touch with them. Ensure that they receive their full pay. Now, this is a completely individual perspective. There are different people who think differently. What I believe is that they depend on us for their little pays of 10, 12, 15,000. We have several times in a month earned maybe 10 times or 20 times or 100 times that amount over so many years and kept that money in reserves. For them, that 10,000 or 15,000 is a big amount, and we should not be depriving them of it. It will help them to run their families, remain healthy. Educate them about clean habits and implement them now so that when they come back to the clinics, it's not something new that they're going to do. And maintain good health by improving immunity. So, the two take home points from the lockdown preparation time is that number one, clean habits, number two, immunity buildup. So number one, clean habits. Always wear a well-fitting face mask whenever you go out of the house. Avoid touching the eyes, nose, and mouth. Do not touch handrails, knobs, lift buttons in public places. Try to avoid lifts and elevators and wash hands frequently with soap. And every time that you wash, it has to be at least for 20 seconds. 20 seconds. These are some of the clean habits that have been taught to us. The government, the health authorities are hammering these things everywhere, on the phone, on the TV, on the radio, everywhere. And what are immunity building and good health exercises? Number one, eat clean, healthy, well-balanced meals, which I assume is happening because now people are only eating at home and all the hospitality services are shut down. Exercise regularly, practice pranayam. Now these are debatable, but as we heard one of our very good dentists a few days back in a wonderful webinar, Dr. Gopi Krishna from Chennai, he mentioned that whatever does not harm you and does not kill you, there is no harm in doing that. Like having warm water frequently, doing your breathing exercises, pranayama regularly. No harm. Go ahead and do it. Whether it benefits or not, we don't know. Nobody knows because this is a new virus. Nobody knows anything about it. Take supplements for immunity buildup. What are these supplements like? Few of the supplements that we would like to show you are the one on the top left that you see is a daily greens, and the top right that you see is a gram muscada. All those who heard the Prime Minister's address for extension of lockdown would appreciate that he in his address at 10 in the morning had mentioned that have kada regularly. Now you can either have homemade kada or this is a ready-made kada. Both these products are made by a company called Wellbeing Nutrition. So no harm in trying that. C cod is 7 C's cod liver oil, quite well known. And these are multivitamins which help to build immunity. So to say, we don't know whether it is going to protect us against COVID, the SARS-CoV-2 virus or not, but we can at least try. So once we do both these things, is there any other prep that you need to do before you go to the clinic? Yes, there's one. That is this, hydroxychloroquine. This is given prophylactically to the dentists, associates, and assistants 1 week prior to resuming practice. What is the dosage? 400 milligram twice. So if you plan to open your clinic on the 10th of May, on the 3rd of May, you have 400 milligrams in the morning, 400 milligrams in the night, and then one tablet of 400 milligram once a day, every week for the next 7 weeks. But if the dentist or any of their associates have a cardiac history or ophthalmic history, then they need to meet the cardiologist or ophthalmologist before they take this tablet. Now, once you have had this tablet and a week after that, you're ready to go to the clinic, what will happen when you go back to the clinic? Number one, please understand and accept that you will not have patients. Patients are not going to come. They are not waiting outside your clinic, waiting for you to come so that they can come and open their mouths. There are going to be no patients. Only the ones who are in severe pain will come to you. That too, they will first make a phone call. When the phone call happens, try to tackle the patient's complaint on the phone call so that the patient does not have to come to the clinic. Do not be greedy. Do not think that you have been sitting without work for 2 months, sitting without income for 2 months, and you want to make money. As far as possible, if you are able to deal with the case, it is called telemedicine. If you are able to deal with the case on the telephone, do it on the telephone. Still, if the patient says it is very bad and I need to see you, ask for travel history on the phone of the past 15 to 21 days. Ask for contact with persons with travel history. This may be negative. Both these points may be negative when the patients start calling you immediately after the lockdown is lifted because nobody could have traveled. But this will be applicable from June if you have opened in March. Take a history of fever, COVID-19 in the last 3 weeks. Preferably keep a new COVID-19 case paper sheet which will have all these points written, and you take a consent from the patient where the patient gives you not just the signature but the thumb impression of the left hand. A signature can be forged and it does not stand valid in the court of law. Advise patients to ensure personal hygiene when and visit the clinic properly masked. Do not be ashamed to tell them that before 1 hour before you come to the clinic, have a bath, brush your teeth, clean your nails, be completely clean before you leave your home, and take all probable precautions en route to the clinic. And that's how you need to come to the clinic. Now let us assume that the patient has reached the clinic. Once the patient has reached the clinic, before that, sorry, you could give them medications. Now, what are the medications that you would give? If there is no swelling, please do not give antibiotics. We have no clarity as to when we will be able to actually open root canals or start doing extractions. So preferably, as much as possible, avoid antibiotics unless there is a swelling present. Advised to keep the affected area 100% clean. Ask the patient to be semi-reclined whenever they are lying down. No local application except Colgate Pain Out gel in decayed teeth. And what are the painkillers that we give? The painkillers that we give are the basic paracetamol, or you can give ketorolac, which is a 10 milligram tablet once every 6 to 8 hours, or a piroxicam, which is given, piroxicam 20 milligram, which is given once every 12 hours. What about ibuprofen? There are some reports that not the best option to be given, because in case the patient is a carrier, it may lead to bronchospasm. We know that we don't give it for patients with bronchitis and gastritis. Here, since we are in a situation where we have to consider every patient as a carrier or a COVID positive patient, we do not prescribe our favorite drug, which is ibuprofen, for some time at least. What about steroids like Visolon? We give it in case of an uncontrolled swelling. It will help in that pain relief as well as swelling to subside faster. As much as possible, we do not get into antibiotics and steroids. So the patient arrives at the clinic. So what do you do first? You do a thermal scanner at the entrance itself. If it shows that the patient has a fever, the story ends there. Send the patient back home then itself. Then is the history taking with the special case sheet that you have prepared, and a sanitizer for all patients. Please understand that the sanitizer that you give to a patient is not the sanitizer that you're going to use, and not the sanitizer that the clinic staff are going to use. There's a little difference between the sanitizer for a patient and a sanitizer for the clinic staff. I'll show you what the difference is in the next couple of slides. Social distancing is to be maintained compulsorily in the waiting room. So we have already told the patient that unless it is a geriatric or a pediatric patient, come alone. So if they still come with somebody accompanying them, because we have a lot of men who don't want to come without the wife, ask the wife to stay away from the clinic, maybe outside the premises or on the ground floor if you're on a higher floor. And the list of do's and don'ts should be displayed prominently in the clinic. So what are the things that we can use in the waiting room? A couple of picks for you and the names of the companies so that there is some reference line for you. Now there are multiple companies which are available who are selling all these things, none of which is available to you right now, but it will be at some point or the other. The companies and the products that I show you are of reliable big companies, multinational companies, or established companies where we can be assured of the quality that they provide to you. So the thermal scanner that we show you comes from a company called Chesa Enterprises, which is a Bangalore-based company. And Chesa, of course, you can place your orders online. And the different types of sanitizers is the next slide. The one which comes only for the patient, as you can see, has 83.3% ethyl alcohol. It is plain ethyl alcohol. There is no other content in it, and that's all that is required. Now, the patient has had a bath, probably put on gloves or sanitized his or her hands. When they have left home, come here with a mask. Now, when they come here, ask the patient to roll up the sleeves, and this sanitizer, which is exclusively for a patient, which is pure ethyl alcohol, comes from a French company called Septodont. The patient has to apply not only on the palm and the back of the hand, but right up to the elbow, because the patient will be going onto the chair and sitting with the elbows resting on the armrest. So you apply the sanitizer right up to the elbow and ask the patient to remove the footwear and put on a foot cover. So now the patient foot cover and head cap, and this makes the patient safe in the sense the patient can't now come and transmit some infection to you till the time that he or she opens the mouth. So what is the sanitizer that a dentist or dental assistant or associate uses? It's this one. It's called a derma film. A derma film also comes from Septodont. The only difference is that here it is a combination of ethyl alcohol 77% as against 83.3, but here it contains chlorhexidine gluconate. So because of chlorhexidine gluconate, it will have a better penetration and it will retain on the surfaces of your palms and back of your palms and hands for a longer period of time. Because as we all know, the substantivity of chlorhexidine is excellent. So that is what is the role of chlorhexidine. So we need not use, even derma film is not that expensive, about 400 rupees for a 500 ml pack. And the one for the patient obviously costs a little lesser. So these are the two different types of disinfectants or sanitizers for the patient and for the doctors. So this prep happens in the waiting room. Now, what is the next step? The next step is that the patient walks into the operatory. So is there some difference in what we used to do back then and what we are going to do right now? Yes, there is a difference. Now, there are two things that need to be prepared inside. One is the structure, that is your clinic operatory with your equipment and instruments. And two is you yourself and your assistant. So what are the preps that we are going to do? The first prep is that we are going to prep ourselves. That's called a personal protective equipment. Now, what we are going to talk about personal protective equipment is as per the guidelines given by the National Personal Protective Technology Laboratory, which is based out of America. All these chemicals that we are talking about, whether it is alcohol or alcohol mixed with chlorhexidine, or we talk about the respirators, are all recommendations given by either the CDC, which is the Centers for the Disease Control and Prevention, and the NIOSH, which is the National Institute for Occupational Safety and Health, and the OSHA, that is the OSHA, which is the Occupational Safety and Health Administration, all of which are based out of USA, and sadly, they are the most badly affected country in the world as of today. So this PPE, as per the NPPTL, compromises of the following lists of things. One is the surgical gown, which can be either disposable or autoclavable. We have had experts who have suggested to us that we can use autoclavable, but there are studies which say that once you autoclave the autoclavable, then the efficacy of that fabric does not remain the same. Also, in terms of disposable, the prerequisites as per the directions of the government keep on changing. Earlier, it was said that it should be fluid resistant. Now, 3 days back, there is a government directive which says that it should not only be fluid resistant, it should also be virus resistant. And none of these things are easily available. Can you just go and buy it off the shelf? It's not there. Even the frontline warriors who are working in the government institutes treating COVID positive patients still do not have an ample supply of PPEs. So there is still no question of the dentist getting it off the shelf. The requirement of the N95 respirators, the biggest manufacturer of that is 3M in the US of A, and they are unable to supply even to the hospitals of the US of A. So where is the question of them reaching India? It will reach sometime or the other, but not as of now. Surgical masks, yes. Face shields, a lot of people are making. Head caps, nitrile gloves, and shoe covers are also there. Now, are we supposed to buy all of this? Depends upon the zone where you're working, depends upon when you intend to start work. There are a lot of dentists whom I know all over the country, all over the world, not as many, but all over the country. I would probably know well a few dentists in every district of the country, including the states of Nagaland, Tripura, Manipur, Mizoram, Bihar, Jharkhand, name it, and I have people everywhere. And I have been in touch with most of them because we are sitting free the whole day. And I've got feedback that in some districts there are not a single cases and people have been working as it is. So these guys would obviously not need to go ahead and buy all this. Now there are some experts who say that there is going to be a paradigm shift in dentistry where a PPE is going to be mandatory. Probably, like I told you in the second slide of the presentation, that COVID-19 expect the unexpected. Probably it may happen. We really don't know, but probably it may not happen because there are certain of my friends who are working in Singapore and also in certain parts of China. And there they say that initially they were working with PPEs, but now as there are no cases, new cases being reported, all the existing cases are being treated, they have gone back to the old protocol of working. So for the people who have a hang up or reservation towards working with PPEs, please be assured that it may not be a compulsory thing at all. You may go back to working with the protocol that you are following, but obviously you would be more careful with what you do now that you have seen something unexpected happening with COVID-19. So these are the things in PPE, of which the one which has been most attention catching has been the N95 respirators and surgical masks. and all the other things. Now, if you look here, here you have an anti-fog face shield. This thing has been quite widely publicized on the University of WhatsApp. A lot of people have shown us how you can make it yourself. If you go to buy, it may cost you about 100 rupees. And this part, which I'm highlighting now, has to be changed after every patient. This is a disposable surgical gown. And as you can see here, the surgeon is getting dressed. You will see that they have a head cap. They have a scrub on which he is going to wear a disposable surgical gown. And you will see that there is a surgical mask. The additional protection that we are advising now is that underneath this, you should have a N95 mask. The difference between a surgical mask and an N95 mask is that a surgical mask can filter out about 80% of particulates, and N95 mask can filter out 95% of particulate matter. So what we are looking at is an N95 mask, and on top of that you cover it with a surgical mask and you wear a face shield. So what does it look like? If you take the entire picture of a dental surgeon, this entire package can be purchased from one company, which is a surgical gown that you see here, which is a disposable. It's not an autoclavable, it's a disposable one. You got a face shield, you got a head mask along with it. You got a 3-ply mask in this, underneath which you wear this one, which is an N95 mask. You got surgical gloves and shoe covers. Now, all these things can be purchased as a package from either Confident Dental Equipment or from Chesa, one of the two, whichever you like. Of course, there are many companies who make this, but as I told you, whether they follow the norms which have been prescribed by the government, we really don't know. These are renowned companies which we assume are following all the norms. So what is N95? N95 is an air purifying negative pressure respirator, which is equipped with a filter which is certified by the OSHA. Certified by the OSHA, which I mentioned before. Available in 5 sizes. How can you decide what size is yours? Buy one of each size and then select whatever fits you best. Basically, air should not escape from any side. It should fit your nose, your cheeks, your cheekbone, everything perfectly. And this has to be covered with a surgical mask and a face shield. You can have an N95 mask for a single session extended use or a reuse, but no washing or autoclaving. Now, this particular point, the bullet number 4 that I'm mentioning, is highly debatable, because before COVID-19 came in, what was prescribed by the CDC was something different. What is being prescribed by the CDC right now is something different. What were they prescribing till now? Basically, none of us, a few of us may have used N95, but not most of us, because we were not even aware that we needed to use. Please note that the CDC, that is the Centers for Disease Control and Prevention, has in a paper in 2005 published that a dentist is 23 times more prone. Please note, a dentist is 23 times more prone to chronic obstructive pulmonary disease as compared to a normal person, because of chronic exposure to aerosols in their operatory. Now, what is this aerosol? What is this aerosol? Now, I don't have I have a slide here to support that. Just because I remembered this point on COPD, I would like to tell you here that we are hearing a lot about aerosols and about the Supreme Court banning the use of machines and equipment that can create aerosol. Now, an aerosol can be of 3 types. Please understand, 3 types. It can be a spatter, which is higher than 50 microns. It can be a droplet, which is lower than 50 microns, or it can be a droplet nuclei, which is less than 5 microns. And my dear friends, most of the aerosols that we generate in our clinic, other than the water which keeps splashing out, is less than 5 microns. So there's aerosol all over. We were exposed to aerosols of TB, of H1N1, of I don't know what all. And we probably have developed antibodies to all those things. We may have probably even developed antibodies to COVID-19. We don't know. There's a lot of ambiguity about that. But as a matter of keeping ourselves safe, our families safe, we would use an N95 respirator. And N95 respirators are expensive. That is why not only expensive, they are in short supply because of the high demand due to COVID-19. And that is why CDC is trying to give you ways and means how you can maximize the usage of a N95 respirator. What they had specified earlier was that after an extended use of 6 to 8 hours in one session, you remove it. The way you don and way you doff your PPE is there all over Google. You can just check how it happens, in what sequence it happens. So when you remove your N95 respirator, you put it into a breathable brown paper bag and leave it like that in a non-air conditioned room for 72 to 96 hours. And then it is good enough to wear back. So on the brown paper cover, you will write the date and the time when you put that mask in and leave it there, and you pick it up after 4 days are over and you can use it again. If there is a splatter that falls on your N95 or an aerosol that falls on your N95, then you need to discard your N95. An N95 cannot be washed or cannot be autoclaved. It has to be just disposed. But in our case, this may not happen because we are going to wear an N95. We are going to cover it with a surgical mask, and further ahead, we are going to have a face shield. So the chances of the N95 getting wet is as good as nil. So we would probably have a very long extended use of N95 without having to change it. But obviously you need to have multiple sets. So each person in your clinic needs to have 5 N95 masks. So if you are 2 dentists and 4 assistants, so that means there are 6 of you all, you need 30 N95 masks. That's the quantity that you need to buy. And on each mask, the initial would have to be labeled so that you know which mask belongs to whom. And each mask would have one cover and keep it in that. But what does the CDC say now? Now they say that probably the guidelines that we had given earlier may not be applicable to COVID-19. It may not be sufficient that you put it in a brown paper bag and leave it in a non-air conditioned room for 4 days. So what do they say? They say you have to put it in a low temperature sterilizer with sodium hypochlorite. And what does the sterilizer cost? It costs 16 lakh of rupees now. Is it available? It is not even available. So as I told you, the topic today is dentistry, post-COVID dentistry, a practical approach. If you ask me, there's obviously no need to buy that sterilizer, and we could probably go ahead with the CDC guidelines, what we have been following till today. And those who want to follow the latest guidelines are welcome to do so, but I see no harm in maintaining what we have been doing till now. That is, you leave the N95 mask in a breathable brown paper bag for a clear 4 days, 96 hours. So that's about N95. And this is one of the most famous or maximum used N95 mask, which is made by 3M and which in all probability you will not be able to procure. So you would have to look for options which are equivalent to them. And what else? Once we have prepared ourselves and our staff, the clinic sanitization protocol needs to be followed. The floor cleaning. The floor cleaning, the sequence to be maintained is that you clean it with water, then you clean it with detergent, and then you clean it with a disinfectant. What is that disinfectant? 1% sodium hypochlorite. The surfaces, as you see here, it is mentioned, is a 1% sodium hypochlorite or a 3% hydrogen peroxide. A 2% glutaraldehyde or a 70% alcohol optionally. UVGI is ultraviolet germicidal irradiation, but we do not have a lot of evidence to support that it will act on this virus. It does act on a lot of bacteria and a lot of germs and a lot of infectious viruses which have come in, but we do not have evidence that it may work on the SARS-CoV-2 virus. Air filters, we know that there are 3 different types of air filters. We will show you all the 3 different types and which one is most recommended for a dental clinic. A high volume evacuator, which is now commonly understood as an extraoral suction, and ideal disinfectants with an ultrasonic bath and a B-class autoclave. So what are these stuffs? I'll show you some pics. The upper left one is the sodium hypochlorite, that is Clorox, which is available at any of the supermarkets. It is basically a bleach. It's not a dental product, so a dental dealer may not have it. Go to your supermarkets, D-marts, you will get Clorox there. It's a 6% sodium hypochlorite, and this is a HEPA air filter. There are three different types of air filters. The one you see here on the upper right is a HEPA air filter. This is an extraoral suction or a high volume evacuator. What is the scientific name of it? Which was recommended by the CDC for use in every dental clinic in 2003, so that the dentists do not suffer respiratory ailments. And this, what you see, is a UVGI, which is a ultraviolet germicidal irradiation. So what's a high volume evacuator? This is something which has caught the fancy of most of the dentists. So do we need this? We will need this when we start with your aerosol producing procedures, which is when you start using your 3-way syringe, your aerator, and your scaler. And at that point in time, if you still have positive cases in and around your clinic, this will keep you safe. If you work in a district which has no cases at all and no new cases being reported, you may probably not have to invest in this. But if you're looking at the long-term perspective of your good health, preventing aerosol in your clinic and preventing other ailments which are aerosol induced, then it may be a good idea that you go ahead and buy this equipment. A high volume evacuator is an extra oral suction in simple words. So what is this extra oral suction? We all know the high vac suction or the low vac suction that you put in a patient's mouth. There will be no more low vac suctions. We'll have to put a high vac suction. So the high vac suction actually goes inside the patient's mouth, and the high volume evacuator remains outside the patient's mouth to capture all the aerosol that is being generated in the patient's mouth by the 3-way syringe, by the aerator, and by the scaler. And it costs somewhere between 60,000 to about 1,20,000, including taxes. So do we have some machines which we can check out? There are two here. One which you may all have seen on WhatsApp. It comes from Confident. It's called a Sterilis Air Plus. And one which comes from Tesa. The Confident one costs somewhere around 1,15,000, and the one from Chesa costs about 70,000. So you can just check the specs and decide which one you want to buy. So that's a high volume evacuator of the 4 things that we were discussing in clinic sanitization protocol. What is the second thing? The second thing is the one which you buy from the DMart, which is called a Clorox. It is basically used for cleaning the floor. You can also use for cleaning the surfaces and stuffs in the dental clinic, including your dental chair. What does it contain? It's a bleach. So it contains 6% sodium hypochlorite, comes in a 500 ml bottle, which costs only 90 rupees. You dilute the entire bottle of 500 ml in 2.5 liters of water. There was some discrepancy earlier where it was understood that we have to dilute it in 3 liters of water. But now I have in fact spoken to the person who has actually promoted this as a protocol. That is again Dr. Gopi Krishna. And Gopi has clarified that yes, it is no more 3 liters. It is 2.5 liters in which you have to dilute. And how long can you use it? Use part of it, dispense it into a small container. And after you have cleaned the clinic with water and then with soap, you clean it with this 1% sodium hypochlorite, the entire floor, This will help for maybe a week's time. So every week you will need 1 bottle worth 90 rupees. Is there some option to this? You have an option which is a Renala, which also is a bleach, which is a 4% sodium hypochlorite. So that was the second point what we saw. What was the third point? The third point is air filters. Now the 3 types of air filters are the HEPA air filters, which is a high efficiency particulate air, the gas filter cartridges, and the electrostatic filters. Now the gas filter cartridges and the electrostatic filters are not so much in use now. It is just so that you know that these things exist, that I'm sharing it with you here. The HEPA is what is endorsed by the CDC since the last 17 years. In HEPA, you get different models. The H14, the H13, the H12, the H11. The H14 is the most potent, and that can eliminate up to 99% of suspended particles up to 0.05 microns. What does it mean? It means that if you have a high volume evacuator that pulls out 90% of the aerosol, In aerosol, I repeat, the splatter, the droplets, and the droplet nuclei, 90% of that gets filtered out by the extraoral suction. But the droplet nuclei, which is less than 5 microns, may escape your extraoral suction at times and will remain suspended in the air of your operatory for anywhere between 30 minutes to 2 hours. So if you have a HEPA air filter in your operatory, it would mean if you have multiple operatories, it will also mean that one HEPA per operatory. So that HEPA air filter will absorb those particles which has escaped your extraoral suction. And what is the fourth point? The UVGI, that is the ultraviolet germicidal irradiation. A lot of dentists already have it. They are already implementing it. It has been proven to be good for a lot of bacteria and viruses, but we do not have evidence, conclusive evidence, which would say that it is effective against the SARS-CoV-2. But what is this UVGI light? It's a 200 to 280 nanometer. 200 to 280 nanometer, to be precise, 254 nanometer is the wavelength of light that it will emit, and it is a 30 to 40 watt tube per operatory. A lot of times in India, we do not get 30 or 40 watt. We get 17 watts. So in one operatory, you have two bulbs of 17 watts. Each operatory, you would spend about 1500 to 2000. I forgot to mention the cost of a HEPA air filter H14 is approximately 22 to 24,000. And this is 1500 to 2000 per operatory. If you have done an aerosol generating procedure in your clinic, and if you do not have extraoral suction, and you do not have HEPA filter, it is advisable that you leave your UVGI light, which is the most economical of all this. If you look at a high volume evacuator, it will cost you approximately 80,000 to a lakh of rupees. A HEPA filter, 20 to 25,000, and a UV lamp will cost you about 2,000. So if somebody is new into practice, unable to afford the higher investments, then you buy at least this and leave it on all the while. And particularly if you have done an aerosol generating procedure, leave it on overnight. And this is what you clean surfaces with. It's again a product that comes from Septodont. It's called a Surfacept. As you can see in the first line, it is again an alcohol. It's an isopropyl alcohol, 70%, again with chlorhexidine, which will ensure that it will remain on the cleaned surfaces for a longer period of time. As I mentioned in the beginning, you could either clean these surfaces with 1% sodium hypochlorite, which is what you got by diluting the Clorox, or with a 3% hydrogen peroxide, which you could buy separately, or with a 70% alcohol, which is Surfacept. Fumigation, whether to be done or not, it is a question mark, because we know that hydrogen peroxide vapors are used for OT fumigation, but we do not have evidence that it is effective on COVID-19. Also, if you have got HEPA air filters and extraoral suctions and your UVGI, then fumigation may not be required. You would not be required to invest into something more. If you already have it, you can go ahead and use it. But there is no evidence to show that it can eliminate SARS-CoV-2 virus. And how do you sterilize your water lines? The water that comes into your aerator. Whenever you are able to use an aerator, scaler, or three-way syringe, then your water lines need sterilization. Very easy to do. The JADA recommendation is that there should be 0.01% of sodium hypochlorite in the water. So what do you do? 1 ml, if you're using 5% sodium hypochlorite for your endodontic procedures, then you put 1 ml of that in 5 liters of water and use that water in the water that you water bottles that you attach to your chair. So the water that comes into the patient's mouth has 0.01% of sodium hypochlorite. It's extremely easy. If you are using 3% of sodium hypochlorite in your endodontic procedures, then you put 1 ml of 3% sodium hypochlorite in 3 liters of water and use that water in your water bottles. If you put more, it will smell bad, and also, most importantly, it will corrode the tubings of your dental wirings. Once this is done, all the pre-operative preparations that the dentist is prepared, the assistant is prepared, the clinic is prepared, and all the aseptic procedures have been taken care of. The patient comes in, sits on the chair, and what do we do in the pre-operative procedure? ask the patient to use a mouth rinse, which can be a 0.2% povidone iodine or a hydrogen peroxide. Now, hydrogen peroxide would be 1%, povidone iodine will be 0.2%. Povidone iodine 0.2% is more freely available, so maybe you should go ahead with that. Scrub the perioral area with 0.2% povidone iodine. Patient drape and head cap in place. And the rubber dam is a question mark we have put here. Now, we have had a lot of experts who have suggested that rubber dam is compulsory and we have to use a rubber dam for every procedure that we are going to do after we get back to practice, provided that we are not practicing now. This is not for those people who are still practicing. So is rubber dam completely essential whenever we are doing non-aerosol generating procedure? Please understand, when you do a non-aerosol generating procedure, if you use a rubber dam, it helps to prevent saliva contamination. And we know for a fact that this virus exists in the saliva. But when we are going to do a aerosol generating procedure like an RC opening, or you're going to use whatever for a restorative procedure or scaling, and if you're going to use a rubber dam, the Journal of Infection and Public Health in April 2017 had done a survey to compare the contamination with aerosol. They did not use a high volume evacuator. They just used the procedure, did the procedure with a rubber dam and without a rubber dam. And their findings were that when they did a procedure with a rubber dam, the amount of aerosol droplets which were collected on the personal protective equipment of the operator was higher than when a rubber dam was not used. So please do your own study, but this is what study I could find, that when you do an aerosol generating procedure, probably doing it without a rubber dam may cause less aerosol contamination. And what are the operative procedures that you can do? Obviously, till the 30th of May, please note that there is a Supreme Court order which has said that no aerosol generating procedure till the 30th of May. After that, take the due precautions based on what is the situation at that point in time in the country. Please understand that everybody is making efforts to make sure that things don't go out of hand. Let us try to do this. So no aerosol generating procedures till the graph plateaus, or till May 30th, any which ways. But after May 30th, if the graph is still showing upscale, hopefully it should not be, then whenever the graph levels out, we can start with aerosol generating procedures. For emergency restorative procedures, you can use a micromotor which will not generate aerosols, and you use products like Kerisol or Depulpin, which are non-arsenic products which you can put in and the patient gets a pain relief. Leave it with the closed dressing. When you give a closed dressing, please make sure that the size of the dressing should be more than 5 millimeter thick. The size of the cotton plug or the Teflon tape that you pack into the pulp chamber should be smaller, and the size of the dressing should be bigger. Also, the dressing that you put should be having setting expansion and not setting shrinkage. The dressing of that sort is called, what you get easily is called Caviton. Caviton comes from a company called GC. So use that, it will ensure that there is no seepage and secondary infections. So these are the operative procedures that you would do before aerosol generating procedures are permitted or safely allowed. And after the procedure is done, these instruments need to be cleaned. Obviously, we know the solutions in which we clean our burrs and with which we used to wipe. We used to wipe clean. A lot of people would just wipe clean our instruments, but now we need to put it in an ultrasonic bath. And in that ultrasonic bath, what we put is called a QuitaNet Ultra. The QuitaNet Ultra is a 20 ml solution you put in 1 liter of water, and it will remain active for 24 hours. So what you need to do is leave your instrument in this solution, which is kept in your ultrasonic bath, and let it remain there for an entire hour. 1 hour is all that is needed, but then you will not be seeing so many patients. So you can even leave it there for 2 or 3 hours, or maybe the whole session, doesn't matter. And this has been documented to kill a lot of types of viruses like HIV, herpes virus, influenza viruses, H1N1. Obviously, we do not have evidence that it kills COVID-19 virus also. What else would we require as a disinfection protocol after we start working? A lot of times we'll obviously do our bread and butter and jam, which is prosthodontic work. So we make an impression. The impression should be disinfected so that in case the patient is a carrier, the virus should not reach the lab and infect your lab guys. So it's a small act of sensitivity which we do from our side as dentists, is that you disinfect the impression with this product which is called Diminol. So with Diminol, you disinfect and then send the product, the impression to the lab. And this is what is an ultrasonic bath, in which you put about 20 ml of Quintanet in 1 liter of water. And this is a class B autoclave, which comes from several companies. You can buy that. So these are the things that in a broader perspective, I try to give you a very practical approach as to how you can remain safe, how you can keep your procedures safe, how you can keep your patient safe, how you can prevent the spread of this dreaded virus by coming back to work. If you do it in the correct way, in the correct timing, then obviously things are going to go right for our country, for our world. And in the words of my good friend, Dr. Ashok Jain, in 1990 to 2000, we had an HIV epidemic, which we did come over. In 2009, 2010, we had an H1N1 pandemic, also which we overcame. In 2018, 2019, we had the Nipah virus, and in between, we had the Ebola virus. We have been through challenging times earlier, and this too shall pass. Thank you very much, Santosh Ravindran. And I will be going through your questions. We have about 12 minutes given for question answers. So I shall go through your questions as I can and answer you while I'm talking. You will probably see me on the screen, I'm not sure. Gauri Merchant from Mumbai has asked, is sodium hypochlorite going to be the new magic word? It was always a magic word. I wonder why people used to not use it in endodontics, because as far as my endodontic teacher, Dr. Anish Navre, says, there is no endodontics that can be practiced without sodium hypochlorite. So yes, sodium hypochlorite now will not just go into the root canal, it will also clean your floor, it will clean your surfaces. It will keep on going into your patient's mouth, because that's what is going to come through your dental water lines. Amudan Aragan has asked from Chennai, any dental procedure with aerator or scaler is going to create aerosol? How are we going to decontaminate? I think in my presentation, I have covered it. Number one, you will have a high vac suction intraorally. You have an extraoral suction, which will take away 90% of the aerosol. And then you have your, if you have a HEPA air filter, it will filter out the remaining stuff. And if you have a UVGI, whatever else, that also will go. How many times can you use a PPE? PPE, as I told you, can be two types. It can be either autoclavable or disposable. The autoclavable, a lot of people use, but there are some studies which say that after it is autoclaved, then it may not be as safe as it could be. Jacob Paulos from Ernakulam has asked how to practice dentistry after COVID-19. I think the last 45 minutes I explained that. Alagan from Tiruchirappalli has asked how about charging the patient for each treatment? Till the time that you're going to use, the PPE, you would have to factor in that cost somewhere. Obviously, you're not going to pay through your pocket for it. So if you were charging, for example, 300 or 500 for an extraction, you would have to add the cost, additional cost onto that, which would be, say, the PPEs are currently available anywhere from 175 rupees to 2000 rupees. So, and some of it has to be disposed after each treatment, but not all of it. So you need not factor in the whole cost. You can factor in just the cost of what is disposable. Dhananjay Patil from Nasik, your question I already answered. When you can start practice post lockdown? As I told you, depend upon the zone that you are in. How many, I mean, whether it is red, green, or amber. When the lockdown is lifted, if it is in a green zone, you can start immediately, but no aerosol till May 31st. And if the lockdown extends till May 30, then we will have a new directive as to when you can use the aerosol producing machines. If you are in an amber zone, then 14 days after lockdown is lifted. And if you're in a red zone, like I personally am in a red zone, so that will be 21 days after the lockdown is lifted. Can PPE be reused is what Deepa asked. It can be if it's autoclavable. Also the question is if there is a practically impossible to work without AC equipment like HEPA filter, aerosol suction is expensive to buy as you would have to take a loan. I'm worried about expenses. If you are able to work without an air conditioner, there is nothing like it. You have to have a non-air conditioned room. That is, even if it is air conditioned, leave your windows open. If you have to have an air conditioned room, then you get a what is called a electrostatic. It's called an electrostatic HEPA filter. Electrostatic HEPA filter, which hardly costs 300 rupees. It can be fitted into your existing air conditioner. So that has to be done by your AC mechanic. So they're the people whom you'll have to contact. So if you can't buy the other things and you would like to endanger yourself to the virus by not buying any of this equipment, if you're in a red zone, I would suggest that you buy some of this, or at least if you're in a green zone, then just an electrostatic HEPA filter to be fitted in your air conditioner. Dr. Bipin Aneja Sonipat, when to start practice, already explained. Charges also explained. Shonit Naik from Dakshina Kannada, one of the favorite parts of the country where I like to go, is as much suit part of the PPE. Some people suggest that it should be a part, but there are different opinions to it. You can come in a particular now. The protocol of doffing and donning and doffing has been clearly defined, and you can go to Elder Sister Google and just check how it is done. But there has to be a designated place where this happens. So when you go from home, the clothes that you wear are going to be different, which you will change in your clinic, and you wear the scrubs which we see the surgeons wearing when they go into the OT. On top of it is what you will wear, which is the disposable PP suit, which I showed you, which comes from Confident and from Chesa. Supriya Patil from Pune, do you get HCQ without prescription? No, you will require prescription, but the government of Maharashtra health minister was today considering the option of giving chloroquine, but the chloroquine, what will be given for malaria and what is given here are different. So this is hydroxychloroquine. You would require a prescription. Yes. Anoli Agrawal from Dhule, what are the side effects of HCQ? No side effects if you do not have any cardiac background and ophthalmic background. Supriya Patil from Pune, is there a COVID-19 consent sheet template if a patient comes with fever due to dental infection and no other COVID symptom? If a patient does come like that, you just prescribe the patient and do not try to do anything superhuman. Prescribe and send, means on the phone itself you can prescribe and tell the patient to come back only after the fever subsides. No patient who shows any signs of fever should be taken into the operatory. What if patient comes to the clinic who has taken paracetamol before visiting you? A lot of people escape the thermal sensors at the airport by doing that, by taking paracetamol 1 hour prior to landing. And this is what I say, that we are basically, in India, we are a genetically indisciplined people, and there's nothing much that you can do to treat this indiscipline. But I must also say that COVID-19 has taught a lot of lessons, and a lot of people have become much more disciplined. We see much lesser of spitting around. We see people trying to maintain social distancing, what Modi ji has tried to incorporate into our brains, and a lot of people are doing it. So let's hope that people follow that. Srikant Ala from Sedgwick. Now this is in UK, I suppose. So he wants to know about isopropyl alcohol. As I had explained, this is one of the ways that you can disinfect your surfaces, other than 1% hypochlorite and 3% hydrogen peroxide. Vikas Tiwari from Kolkata, can COVID-19 be transmitted by cigarette smoke? Ideally, we would not see too many people smoking now, because even the directive given by the Prime Minister's office after the extended lockdown very clearly states that the sale of tobacco and alcohol will be strictly prohibited. So, but there is no evidence to show that it will be transmitted to that. Can we use contra-angle handpiece? Sunil Danole from Kurundwad. Can we use contra-angle handpiece for emergency opening? That is a micromotor. Yes, you can use it, but depending upon the extent of cases, the graph in your area, you would have to use the protective, personal protective equipment. I have taken 20 questions. I don't know the Dr. Reddy's lab guys. Are you there, Tejas? If you're there, please tell me when the time is up.
Oh, sir, you can keep on, sir. It's not a
Keep
problem.
going. So whenever
Yes.
you want me to stop, you can ask me because
Yeah, sure.
there are a lot of questions. So I'm just taking it one after the other in the sequence that they have asked. Ganesh Chaudhary from Faizpur says that there have been no COVID patients in the last 25 days, and we do not have a supply of genuine N95 mask. So should we use surgical mask and face shield to cover it? Seems okay. Theoretically, you would be advised to use an N95 mask. It's not available now because there's a lot of demand globally, but it should be available. But till the time that you get it, if you think that you need to go and work on a patient, then yes, a surgical mask instead of 95% will give you 80% protection. Not the one which the blue one which we used to use, the hospital one, the 3-ply one, the green ones, you could use that. Amir Reddy from Hyderabad asked, what should be the precautions of sterilization of brown cover? There is nothing to do because what the CDC had said that you leave it open in a non-air conditioned room for 4 days, and that is sufficient to kill whatever microorganisms stick onto the outer surface of the N95. Not much will stick, please understand, because on top of it, you have a surgical mask. Covering that, you have a face shield. So there's not much that would go and stick. So it's just a matter of protocol that we are going to put it in a brown bag. Now, this again is debatable because there are people who would say that you need to put it in a low temperature sodium hypochlorite sterilizer. Personally, if you ask me, there is no need to invest 15 lakhs in it. Already the market is too bad. Already you are sitting in a non-earning condition. So I would suggest you do not go in for that. Just leave it in a brown paper bag. Make sure your mask is labeled with your initials. The brown paper bag also has your initials. So, and plus the date when you're putting it in. I can't even read the name. Olavara Harish. I can't hear you, Tejas. Yeah. What is the disinfectant protocol in between patients? What is the best fumigation protocol? Believe me, you will have a lot of time to disinfect between patients. A lot of people who were seeing, say, 30, 40 patients a day will now probably see 10 patients a day. So you will have enough and more time to disinfect. And as I mentioned, that fumigation will not be required. Rubina from Kolkata, a breathable brown bag is a paper bag. Yes, it is a paper bag. Rupanjan Roy from Kolkata asks how many times this process can be repeated. This process can be repeated quite a few number of times till the time that your N95 mask is not exposed to an aerosol, does not get wet, or does not get inadvertently contaminated by you with contaminated hands. You can keep on doing this. Sridhar Kudumuru, I have already answered your question from Hyderabad.
So we'll end the question answer session by 5:15.
What is the time now?
It's 5:03. More 10 minutes, sir.
10 minutes. Okay.
Yeah.
Tell me. Can we mix bleaching powder in water for floor? That's what I explained, Shrikant Ala, again from UK, I think. Yes, we can. You can mix it, but please make sure that the percentage that you achieve is 1%. So you have to calculate what percentage of sodium hypochlorite you're mixing with the water and the quantity of water. When you're mixing Clorox, it's going to be 500 ml with 2.5 liters. Please note 2.5 liters. Praveen Bansal from New Delhi. No, sorry, you need to do it every day. You can't just wipe and not wipe for the next 1 week. Like we have bath every day, you have to bathe your clinic every day. Do we clean the floor after every patient? No, you clean it daily once. That is Sharmila Shinde from Mumbai. There may be a lot of people here whom I'm answering and whom I may know, but please excuse me because I may not know all of you by name. Dr. Mustafa Fakri, it's the same question from Surat, so I will not go into it. Anand Malhotra from Delhi, can AC be used in the clinic because you can't be wearing a PP and you will be unable to work without an AC? See, these are difficult times when we need to learn to adjust. So we have been living without an air conditioner for ever since I think the 16th of March. I can't remember the last summer when we were without air conditioners. So you can try and be without an AC. But if you just have to have an AC, then you put the electrostatic HEPA filter in your air conditioner by asking your AC mechanic to do that. Ashok Kumar from Coimbatore, Rinala is 4%. That's a mathematical question. You can calculate it and do it yourself. And you can say hi to our Coimbatore gang. Supriya Patil from Pune, do we need all high vacuum evacuator, HEPA and UVGI, or any one would do? It depends upon what zone you're working and at what point of time you are going to restart doing aerosol creating procedures. So I know a lot of friends who say that I'm not going to start working till September because I don't want to take the risk. By September, if there is no more corona, we go back to what we were doing, probably what we were doing earlier. Will electric motor reduce aerosol emission? Yes, obviously it will reduce because there will be no aerosol. That was by Anshu Sachdeva from Hyderabad. Mikita Shah, PP kit to be changed after every patient. If you're doing an aerosol, if you're doing an aerosol generating procedure and your kit is obviously, and you do not have an extra oral suction, and there are a lot of times the droplet nuclei, obviously a droplet nuclei cannot be seen with the naked eye. So if you have done something like that, you would have to change your gown. The disposable gown gets disposed. Sri Mani from Bangalore, can we do complete dentures? You can do it as soon as you restart your clinic after the mandatory period after lockdown is lifted. But you would have to use Dymenol in addition to your personal protective equipment and all the procedure that I explained for the patient, the prevention and the clinic and your staff. After you make the impressions, you would have to disinfect it with Dymenol. It's a impression disinfectant that comes from Septodont. Sanjay Khernar asking whether scrubbing the patient's face with alcohol is advisable. Alcohol, which alcohol by you mean? Alcohol is not easily available, number one. But the alcohol that you have in your clinical use, you can use it. As I told you, it will be optional. The best would obviously be povidone iodine, which is a standard scrub that we use even in the OTs for general surgeries. So that's to Sanjay Khernar in Thane. Vaibhav Mathur from Ajmer, how long to wait after the last case reported in the area to be safe? Ideally, as I told you, 21 days from the time that the last case is reported, it would be safe to start with your procedures. Deepak Jain from Durg, is fogging useful to sterilize operatory? There is no evidence to say that fogging with HPV is useful against this particular virus. So probably not advisable. Instead, you can go for the high volume evacuators and the air filters and the UVGIs. Arjun Nayak from Mangalore. It is, I guess, Arjun is Dr. Krishna Nayak's son. Can pregnant women be treated as an emergency during this month? That's you need to take the clearance of the gynecologist, because if her pregnancy is normal and you are going to treat her under a coverage of cephalexin and nothing more than that, and she can do the treatment in the second trimester, then you can go ahead and do it with the same precautions that we do for any other patient. Amir Reddy from Hyderabad, is it compulsory to use separate hand sanitizers? No, it's not compulsory. It's only from a question of not spending too much that I suggested, that you use the 83.3% alcohol for the patient, because it is much more economical than the derma film. The patient hand sanitizer, which is a pure alcohol from Septodont, has not got a specific name as of now because it's a need-based product. So the company is manufacturing it for us now. So they haven't named it as yet. Priya from Mysore, instrument bath. I showed you the pic. It's an ultrasonic bath in which you put 20 ml of Quintanet, 20 ml of Quintanet in 1 liter of plain water. Tushar Srirao, hi Tushar from Nagpur. He has asked for dental assistant protection. The dental assistant protection is the same as what protection you would take for yourself. It is the same what you will take for yourself, nothing different. Only for your receptionist, if the receptionist is not going to come into the working area, then it would be a little lesser. There is a graph which is there on Google that you can refer to, but primarily we all have to keep ourselves safe. How about using a question from Chennai? How about using autoclavable surgical gowns replacing PPE? Yeah, you can use it. In fact, Dr. Gopi also recommends that. So you can use it. The only thing is there are some studies which say that they're not as effective after you autoclave. So I don't know. You could probably go ahead and use it. Vinod Arora from Pali, ultrasonic bath is some that can be used along with autoclave or alone is enough. The ultrasonic bath is the first thing that you do. And then obviously you go ahead and do the autoclaving. So you can't eliminate either. Umesh Shubhankar, should we use exhaust fans? Rather than using exhaust fans, you could probably keep your windows open and practice working in some amount of the humidity and heat which is here. Neelam Shauri from Panchkula, disinfectant tunnel. That is probably too much of an investment looking at it from the dental clinic point of view. So that is, we would use that when we have a hospital with a lot of health staff who are going in. They call them HCP, that is a healthcare professional. Nalgonda, Yada Sudhir. Can we use a normal cooker instead of autoclave? Yes, you can use it for cooking your food, but not for disinfecting your instruments. Praveen Dhage from Beed, should we sanitize coming patients? Yes, I explained how it has to be done. That all will happen in your waiting room itself. Sandeep from Gulbarga, your question has been already answered in a previous query. Anand Shah from Panvel, can we do all RC openings with micromotor? I don't think you'll manage to do it. But that's one of the most frustrating things that you can ever try doing, because you will keep on digging and digging and you never reach the chamber. And by the time you reach the chamber, you'll be so frustrated you won't know when you've gone through the roof and then gone through the floor and you're perforated. So rather than that, try and do it only as an emergency. Get into the chamber, put a devitalizing gel into it, cover it with a little bit of Teflon tape and with a lot of Caviton. Ganga Nagar, Bhupesh Gandhi, can we use 6% hypochlorite spray for decontamination after every patient? It's not required 6%. 1% is more than enough. Major Vikram, hi Vikram, where are UV tube lights available? It will be available with our dealers after this shops are open. Hussain Rangwala, is it Kozema or is it someone else? Question is not very clear. Yes, you mentioned that you missed it. We can't go back to it. There's no time for it. I think the time is up. Am I right? Tejas? Tejas? Tejas, are you there? Okay, I think there's still some more time. So how to, Dr. Archana from Pune, how do you see it again? Because you missed the initial part. I really don't know. You will have to email Dr. Reddy's. You can contact the Dr. Reddy's representative in your area and ask them where you can see the recorded version. I don't know whether you can see it or not. Not sure
Yeah,
about
hello,
that.
doctor.
Tejas.
Yeah, sir. There are more than 350 questions. But
So what do we do?
we won't be able to. It's
Many of the
this.
questions are actually repetitive.
Yeah. So what we will do is we'll create a discussion forum for the rest of the questions, wherein all the questions will be answered. All right. So we'll
Okay.
end the today's webinar over here now.
Okay, done. Thank you.